Representative Quattrocchi, please.
Thank you, Mr. Chairman. Are any of you folks familiar with the 15 some odd lines that are going to be scratched dealing with the board requirements for annual reports? You familiar with that?
Not with the annual report piece.
Okay. If I could, real quick, I'll go through it like that commercial, that car commercial where they blah, 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 blah. Okay, so within 90 days after the end of each fiscal year, the board shall approve and submit an annual report to the governor, the Speaker of the House of Representatives, President of the Senate, and the Secretary of State of its activities during that fiscal year. The report shall provide an operating statement summarizing meetings and hearings held, including meeting minutes, subject, addressed, decisions rendered, licenses considered, and their dispositions, rules or regulations promulgated, studies conducted, policies and plans developed, approved or modified, and programs administered or initiated, a consolidated financial statement of all funds received and expended, including the sources of funds, a list of any staff supported by these funds, and summary of any clerical, administrative, or technical support received, a summary of performance during the previous fiscal year, including accomplishments, shortcomings, and remedies, synopsis of hearings, complaints, suspensions, or other legal matters related to the authority of the board, a summary of training courses held pursuant to the provisions of paragraph 5715, a briefing on anticipated activities in the upcoming fiscal year and findings and recommendations for improvements. The report shall be posted electronically on the General Assembly and Secretary of State's websites. The Director of the Department of Health shall be responsible for the enforcement of this provision. So that's like around 15 lines. How did I do it?
What about the side effects?
So I guess my question is, so this is all going to be scratched. It's scratched in the proposal. So is there anything to replace this when it gets shifted over to the other agency?
So I can find out from my team specifically where that's referring to. There isn't any intention to remove some of the standard elements connected with the boards, but I know with some of the transition, there's some consolidating, so that language may have, related to the specific element that's being consolidated that's no longer needed. But we'll continue to work together on providing the normal requirements associated with the board that we have done previously that would continue where it's appropriate. I need to get input from the team as to whether or not that deletion was just related to the board consolidation or some adjustment that made it no longer necessary, but not to remove the actual function of doing that for boards where it will continue with DBR.
Okay, go ahead.
At least three of these boards, 3 of these professions do not have boards, so we'd have to look and see exactly which ones that's relating to.
Okay, because in all the previous wording, there's nothing about eliminating boards. Boards are still mentioned. It's just that it seems like a lot of transparency to the public is being scratched out and not replaced, that's all.
So that actually happens to be in the section 16 that we're going to discuss again later.
Okay.
So we'll have an opportunity even to be able to bring that back directly to you.
Okay. I'll try to learn how to read quicker also.